This medication helps relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan reduces the urge to cough by acting on the brain's cough center. If you're self-treating with this medication, be sure to read the package instructions carefully before starting. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. It's also not recommended to use certain products in children younger than 12 years. Always ask your doctor or pharmacist for more details about using the product safely. Keep in mind that these products do not cure or shorten the length of the common cold and may cause serious side effects. It's crucial to carefully follow all dosage directions to decrease the risk of serious side effects. Additionally, do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients. Always consult with a doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Robitussin Cough-Chest-Cong DM, you can take it with or without food as directed by your doctor. If you're self-treating, make sure to follow all the directions on the product package, and if you have any questions, ask your doctor or pharmacist for clarification. It's important to drink plenty of fluids while taking this medication, as it will help to break up mucus and clear congestion. The dosage of Robitussin Cough-Chest-Cong DM is based on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take this drug more often than directed by your doctor. If you're using the liquid form of this medication, make sure to carefully measure the dose using a special measuring device/spoon, and do not use a household spoon. For powder packets, empty the entire contents onto your tongue and swallow without chewing. If you're taking the capsule form, swallow the capsule whole. It's crucial to not abuse this medication, as it can result in serious harm such as brain damage, seizure, or even death. Do not increase your dose, take it more often, or use it for a longer time than directed. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, it's important to tell your doctor, as these may be signs of a serious medical problem. Seek medical help right away if you think you may have a serious medical problem. If you experience dizziness, drowsiness, nausea, or vomiting while taking Robitussin Cough-Chest-Cong DM, make sure to notify your doctor or pharmacist. Your doctor has determined that the benefit of using this medication outweighs the risk of side effects for you. Most people using this medication do not experience serious side effects. Although it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. It's important to note that if you are in the US, you can call your doctor for medical advice about side effects, and you may report side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects, and you may report side effects to Health Canada. Before taking Robitussin Cough-Chest-Cong DM, make sure to inform your doctor or pharmacist if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's essential to discuss this with your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid activities that require alertness until you can do them safely, and limit alcoholic beverages. If you are using marijuana, discuss this with your doctor. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid sugar and alcohol, caution is advised, as the liquid forms of this product may contain these substances. It's best to consult your doctor or pharmacist about using this product safely. It's also important to note that the liquid forms and powder packets of this medication may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this medication safely. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's crucial to only use this medication when clearly needed and to discuss the risks and benefits with your doctor. Additionally, consult your doctor before using this medication while breastfeeding, as it is unknown if Guaifenesin or Dextromethorphan passes into breast milk. It's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking certain MAO inhibitors, such as isocarboxazid, phenelzine, or selegiline, while using this medication, as it could cause a serious and possibly fatal interaction. Also, be cautious of taking more than one product containing Guaifenesin or Dextromethorphan, as they are both available in prescription and non-prescription products. Additionally, Guaifenesin may interfere with certain lab tests, so it's important to inform lab personnel and your doctors if you are using this drug. Be sure to talk to your doctor about the best time to start or stop taking this medication, and do not make any changes to your dosage without their approval. If you or someone else has taken too much of this medication and are experiencing severe symptoms such as losing consciousness or having difficulty breathing, it's important to seek immediate medical attention. In the United States, you can call the Poison Helpline at 1-800-222-1222, while Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. Remember, if your doctor has prescribed Robitussin Cough-Chest-Cong DM for you, it's important not to share this medication with others. It's also important to keep all of your medical and lab appointments. This will help ensure that you're getting the most benefit from this medication and that it's working as it should for you. If you happen to forget to take a dose of this medication, take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and take the next dose at your regular scheduled time. It's important not to take a double dose to make up for the missed one. When it comes to storing Robitussin Cough-Chest-Cong DM, it's important to keep it at room temperature and away from light and moisture. It's best not to store it in the bathroom, and be sure not to freeze the liquid form of the medication. Different brands may have different storage needs, so always check the product package or ask your pharmacist for specific instructions. It's crucial to keep all medications out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Be sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.